Hi, I am Angel Andy Vale. In this video, I will be demonstrating Leopolds maneuver. So, this is the systematic palpation of the abdomen for assessing the fetal position and presentation. So, prior to the procedure, wash your hands to protect yourself and the client from microorganisms. I already washed my hands, so I'm going to use an alcohol. So hello, my name is Angel Andy Vale and I am your nurse for today. I am going to perform a quick check to see how your baby is positioned inside your belly. This helps us understand how everything is going and if your baby is getting ready for birth. This procedure includes touching with slight pressure. It called the Leopolds maneuver. So I already closed the door, the curtains, and the windows for your privacy. So, excuse me. Before we start, it is a good idea for you to use the restroom and empty your bladder because a distended bladder may slightly deviate your uterus. This can also make you more comfortable throughout the procedure. So, do you wish to use the restroom?
No, I've already wiped.
Okay. Since you are already lying down, are you comfortable? Do you wish to adjust the temperature?
No, it's fine.
Okay. Can you slightly flex your knees? And I want you to be relaxed as possible. Okay. I will also place a rolled towel under your right hip to shift your uterus away and prevent you from getting supine hypotension syndrome. Okay. I will also stand right in front of you since I'm right-handed for better access in the symphysis pubis in the third maneuver. So is it okay for you to expose your belly? For the first maneuver, I am going to gently palpate on the top part of your belly, or we call this the fundus, to determine if it is the baby's head or the bottom. So this is done to help optimize the baby's position for a more efficient and less complicated delivery. If it feels hard, round, and freely movable and volutable, it is the fetal's head. However, if it is feel softer and nodular, it is the breech or the buttocks of the baby. For the second maneuver, I will start palpating gently on the sides of your tummy, moving downward. This helps me figure out where your baby's extremities and back are. So if the fetal back, a long and continuous structure will be felt and extremities feel bumpy or irregular. So for the third maneuver or the Paulick's grip, I will start by placing one hand or like an L shape gently on the lower part of your tummy near the pubic bone. So this is the bone at the bottom of your tummy to feel the presenting part of the baby, whether it is engaged or not in your pelvis. So if I move my hand gently from side to side and it is movable, then it is not yet engaged. But if it is moving, then the engagement has already occurred. Now for the fourth maneuver, after that I will turn and face your feet. So this let me confirm what I felt in the third maneuver and also helps me figure out if the baby's head is tilted slightly or it is flexed. Okay, I'm going to face your feet. So in doing that, I will gently palpate on the lower part of your abdomen towards your pubis bone. So if prominence is felt at the same side as of the fetal extremities, then the head is flexed, which is a good attitude. But if a prominence is felt at the same side of the back, then the head is extended, which is a poor attitude. So we are now done with the Leopolds maneuver. So I am going to gently palpate your tummy again to find where your baby's back. So once I find it, I will place a stethoscope there for about 1 minute, and just to make sure we hear the heartbeat nice and clear. So it is necessary to auscultate the fetal heart because the fetal heart rate is not with because if the fetal heart rate is not within the normal range, report it immediately to the assigned clinical instructor or attending physician for a further monitoring and intervention. Also, note the location, rate, and character of the fetal heart tone. So we are now done with the procedure. So let me assist you by covering your tummy back and I will remove the towel. So how was the procedure, ma'am?
It's good.
Did you feel any pain while I was palpating?
No.
Okay, so if you have any questions about what we did or anything else, feel free to ask. So we are here to make sure you are well taken care of. Okay, document the observation made, the fetal presentation position, the attitude, and whether it is engaged or floating. Okay. It is important to document all the relevant and pertinent information because if it is not documented, then it means not done. So it can also serve as the databases for the future, which can also be used by the healthcare professional for the continuity of care. So during the procedure, I have determined that the fetal position is at the right occiput posterior, and also the fetal back is found at your right side, and your baby is in cephalic presentation, which means that the head of the baby is at the lower part of the uterus, which is an ideal position of the baby for labor. It is already engaged since it is not movable. That means that the presenting part is engaged in your pelvis. And also the fetal head is flexed since the prominence is felt at the same side of the extremities. And lastly, the fetal heart rate is 140 beats per minute, which is within the normal range. So, is everything I said clear to you? Do you have any questions before we end the session?
No.
Okay. Okay, I appreciate you for trusting me and being cooperative during the procedure. I wish you a normal and safe delivery. Have a good day, and have a good day, you deserve. So that's all. Thank you.